Hi, Dr. Kathleen Young, board certified child, adolescent, and adult psychiatrist. And I want to talk in this video about eating disorders and just eating in general in autism spectrum disorder, particularly people with less obvious presentations of autism. And I keep focusing on this because I think these are the people who get missed in terms of making a diagnosis. And we often call it other things or diagnose other things, but don't approach the treatment through a neurodivergent lens, and which I think could really help improve things. So if you're a parent, you can probably relate to this very much, but people with autism spectrum disorder tend to have a lot of hypersensitivities, and this translates over into their eating. They develop, repetitive patterns, eating the same thing over and over again, like they do lots of things over and over again, because the foods become very predictable. They may have issues with the textures of food or putting two different types of textures together. Like spaghetti with sauce is the noodles have one texture and then there's a liquidy texture. Combining different flavors, they may have a very hypersensitive palate. And so they, by default, tend to eat things that are more predictable. And not always bland, but often it could be bland. Sometimes spicy food bothers them. But I think it's just finding a more predictable way of eating. And then what happens is they eat the same thing over and over again, which can be hard when you're parenting a young child, which I am, because, getting them to try something new can be difficult. And so the reason I'm making this video is because if you're a parent listening to this, I think it's important for you to understand that. And when you're talking to your child or trying to convince them to try something new, to understand about how to introduce new textures one by one or new foods one by one, and not combine so many things and let them have a little bit at a time. And it does happen. The other thing that can happen is that people on the spectrum get diagnosed with anorexia because they become or ARFID, because they become very restrictive in their pattern of eating. They may get fixated on a number that they think their weight should be on the scale. So it's not always body image or a need to be thin, but it could be that they got fixated on a particular weight that they're supposed to be. And so they don't want to weigh more or less than what they think they should weigh. It could be eating, in a very restricted way. And so I think, asking questions and probing a little bit deeper through a neurodivergent lens is helpful to think about eating issues on the spectrum. And I'm going to do a part 2.